we've got to get the hospitals and doctors in line. We've got to get those charges under control. I made it a point to find out every time I had something done and get it done all over the darn country. I'm embarrassed. Nobody wants to tell me how much it's going to cost. When I crawl to one of those X-ray machines or get something done, I did yesterday, and they'll just give you an example. Here at base, I went in this MRI machine, and I said, as I was going in, I said, how much is this going to cost me? And the guy looked kind of starved for me. He runs one of these mobile machines. He runs one of the big still. He runs one of Rogers and somewhere else. Can you hear me back there all right? I don't want to get too hoarse, but he said, well, I know what we charge. I said, well, I want to know what the hospital as well as you folks charge. So I finally got it out of him. For this one procedure I was going to have, he charges $500. And it took about 25 minutes. Then he says the hospital adds $250 to it. And when he got me through, he said, this is what you're going to die about. No, I didn't say that. I knew I would die. But he said, this is what's going to kill you. He said, this brown medicine I'm squirting in your veins costs $78. We charge $78 for it. The hospital charges $255 on top of that. That meant my 40 minutes in under that thing cost me about $1,000. And it meant that the hospital didn't do a thing to get them into town and got half the money. Now, what it means is, that these people are skinning us alive, not just here in Bethlehem, but all over. And they're doing it silently. And they do it with they're charging us 5 or 6 times what they ought to charge us. Not that much, but more. So we need to work on a program where we've got hospitals and doctors and workers' comp for our pharmacies gaining and saving our customers money and our employees money. And we haven't even started to do that. And if we don't get it done this year, I'm going to get real upset.
And now, for today's final keynote, please welcome from Walmart, the Senior Director for Health Benefits, Lisa Woods, and Vice President of Health Transformation, Marcus Osborne.
And where down we go.
So that video was taken of a Saturday morning meeting more than 27 years ago. And the man you saw, he wasn't the wealthiest person in the world. He wasn't the founder of Walmart, the man who led the company to be the largest in the world. What you saw was a man who was experiencing America's healthcare system. And in 1991, he was pissed off. The system was failing him. He was rightfully angry, and he was calling for change. Here we stand in 2018, and America is still pissed. Healthcare is the top concern of Americans and has been for decades. Wars come and go. The economy declines and it improves. Other issues arise and they wane. But healthcare remains consistently as a deep, angst-causing, worry-driving issue for Americans. And what angers Americans most about the healthcare system? Price. The price of health insurance, the price of medical care, the price of pharmaceuticals, and yet prices increase. What else angers Americans? Access. We cannot get in to see the doctor. When we do, they waste our precious time by making us wait. The system seems designed around the interests of the providers, around the payers, around the product producers of drugs and devices, rather than the interests of the customer. As angry as Americans are, if they really knew what was going on, they'd be angrier. They'd be angry that an estimated 25% of the trillions of dollars we spend annually on healthcare is completely wasted. spending that delivers no value. In fact, it appears to be spending that is making Americans less healthy, making their lives worse. Care more expensive than it needs to be. Care that is so poor in quality that it requires Americans to get more care to make up for it. And worst of all, wildly inappropriate care. Care that was not necessary and delivered no value. Unnecessary procedures and bad diagnoses that make our lives worse, not better. It's time we did something about it. It's with that in mind, I get the pleasure of introducing you to the person that I believe has done more to drive real positive change in the U.S. healthcare system than anyone I know. Lisa, I'd love, if you could, for you to share a little bit of your story.
Sure. So thank you, Marcus. So I have the privilege of managing health care benefits for over 1 million participants for associates that are enrolled in one of our medical plans. At Walmart, we spend a significant amount of time thinking about quality and the quality of care that our associates receive, making sure that they get appropriate care and efficient care. We think about and talk about care where they have under-treatment because we know that our associates don't necessarily get all the treatment that they need. And we talk about over-treatment, which we are all familiar with. A surgery or treatment can be performed, can be very successful, but if it wasn't necessary to begin with, is that what we call success? We don't believe so. Our focus has been to positively impact the healthcare space. Everything that we learn, we're willing to share. The reality is, if we don't try, we're never going to know what works and what doesn't work. I'd like to start off by saying thank you to all the health systems, the providers, the doctors that provide quality care and take care of our associates. They are committed to improving quality. They're committed to changing from the foundation up their health systems, and we are blessed with some very special health systems in the country. Unfortunately, when we look at our data, that's not always the case for all providers. So today I'm here to talk to you about our Centers of Excellence program. We have expanded our program over the last 5 years, and it has been a journey, and it has evolved over that time. We evaluated our data, and we were looking for variances in cost and variances in care, and where could evidence-based medicine be applied in the treatment patterns for our associates. There's a few key points that I want to point out. Everything related to this program has been focused on quality. It has never been about cost and negotiating a deeper discount. We believe that we would see downstream savings if our associates would receive quality care. 2, this is all about our associate, one individual at a time for our associates and their family members and changing the health care that they receive. This program, we identified some of the best health systems in the country, and we encouraged our associates to go to these centers of excellence. And it is a benefit for most procedures that's paid at 100%, and we pay for all their travel for themselves as well as a caregiver. So let me share with you kind of a timeline of how this has evolved. 20 years ago, we started with transplants in partnership with Mayo Clinic. In 2013, we added spine and heart procedures. 2014, we added hip and knee replacements. And in 2015, in partnership with Mayo Clinic again, we decided to create a program focused on breast, lung, and colorectal cancer. That program has been a medical review program where we send medical records to Mayo Clinic and pathology slides, and then they recommend if an associate should travel. We don't want our associates to travel unnecessarily, especially when they have cancer. In 2016, we implemented weight loss surgeries. One thing I want to mention, it doesn't matter whether you have 500 employees, 5,000, 50,000, or a million like our plan. This is a program that all employers can implement. There are third-party companies that have implemented Centers of Excellence programs that are very turnkey for all employers, and I encourage you to engage if you can. So what do we know? What have we learned? We hear nationally that there's 30% waste in the system. We also hear there may be misdiagnosis as high as 30%. We are seeing that and more. And so we've pulled data here recently, some data that I'd like to share with you. Spine surgeries, let's start there. Associates that go to their home community physicians that are told that they need surgery, when they go to a Centers of Excellence, over 50% are told that they do not need surgery. 50. 4 readmissions within 30 days. The Centers of Excellence are lower by 95%. And the return to work rates, we're seeing about 3 weeks less when associates seek care at a Centers of Excellence. When we think about joints and what's not necessary as far as surgeries, we're seeing 20% of our associates that are told they need surgery and they go to the Centers of Excellence and it is not necessary. Readmissions within 30 days is 70% less at a Centers of Excellence. For weight loss, we've tracked associates 9 months after their surgery, and we are seeing a reduction of 70% in their drug cost and cancer. What can I say here? About a third of associates are recommended to travel to Mayo Clinic. Of that third, 55% get a new treatment plan or an adjusted treatment plan, and we have 10% of associates that get a new diagnosis. We have associates that have been told that they have cancer, and when they get to Mayo Clinic, they learn they don't have cancer. We have associates where cancer has spread and they were not aware of it. So why does this continue to happen? And how can we stop it? Our associates tell us when they go to a Centers of Excellence that they didn't know that healthcare could look like this. And how could we change and influence the care within their communities? How can we find great care in our communities? And so, Marcus, I'm going to turn it back to you to share a few thoughts.
So I bet many of you have come here expecting some announcement. So let me announce this as clearly and as loudly as I can. I won't stand for this. Lisa isn't going to stand for this. Walmart isn't going to stand for this. 10% of the time, people having a massive misdiagnosis of cancer when there are evidence-based approaches that would have delivered the right diagnosis. 20%, even 50% of procedures being unnecessary when appropriate approaches were known by the system. As our friends at Embold Health understand, we've failed to measure our providers to know whether they are delivering and doing the right thing and whether they are delivering high-value care. As physicians engage with people, do they ask, was the care needed? Did I follow the latest evidence? Was the care the best choice for the patient's overall health? Take maternity care. We know there is huge variation in appropriateness, quality, and cost, but we don't truly analyze our providers. We analyze our hospital C-section rates, but no one can tell us if those C-sections are necessary, how they vary by doctors, and how that physician-level variance translates into overall cost for the system. Well, Embold has shown us that you can analyze doctors and that you can identify the high-value ones and the low-value ones. You can find the good doctors, and you can find the bad doctors, and there are bad doctors. As an example here, they've begun to analyze maternity care, identifying doctors who deliver massively inappropriate levels of C-sections. In just this cross-section of physicians that deliver in a single market in the U.S., we see an 8x spread after adjusting for risk in C-section rates. As we assess appropriateness, that spread you see is indicative of inappropriate care being delivered in the market. And we can now see the impact on total cost that creates and the total waste low-value doctors are producing in the market. It is incumbent that we find ways to help get people to the best, highest value doctors possible. Because behind those numbers, 10% cancer misdiagnosis, 50% inappropriate spine procedures, 8x spread in C-section rates between high value and low value providers, behind those numbers are real people. One is my teacher who had a missed cancer diagnosis, a cancer that was treatable, but that led to her death. Another is my ex-wife, but still partner, who had an unnecessary orthopedics procedure that cost her an enormous amount of time in recovery and cost. And millions of women, many of them who are my close friends, who are getting unnecessary C-sections, harming the health of the mother and child. Even with all our efforts, we are all still failing. We are failing, in my estimation, because we started to believe the institutions and organizations we work for matter more than the customers we serve. But you can today choose to go a different path. Through Walmart, we are trying. We are opening primary care clinics, and we are delivering dental services through partners. We've delivered a retail platform for customers to learn about their health insurance options and enroll in plans. We've partnered with Quest Diagnostics around a retail venture to improve access to health screenings and diagnostic solutions, services that have often been controlled within the system, difficult for consumers to engage. We are lowering prices on RX and OTC items. We are doing all this because customers want access to affordable healthcare solutions, and by God, we're going to give it to them. On the benefit side, we continue to expand our centers of excellence and our relationships with accountable care organizations because our associates need to be getting the best care from the highest value providers. And there's more to come. Optimized networks. Networks built that drive utilization to the highest value providers, that support providers by giving them insights they require to improve their practice approach to deliver the highest value care. But networks that also recognize some providers just won't cut it, and therefore won't get any volume from the network. New transparency tools for consumers that enable them to know whether the provider they are using delivers the highest value care. Not just about price, but about the total package, appropriateness, quality, and price. New services built around the intelligence that comes from knowing what high value care looks like, and that is delivered in a way that is 100% designed around the interests and needs of the customer. Certainly care that is affordable and accessible. Americans need us to act now. Walmart is acting. We aren't going to sit around trying to build another alliance or coalition. Those kinds of arrangements, frankly, have proven to be just bureaucracy, slowing us down. We are moving now. But here's the good news. We've got lots of room on the bus. So join us. We will succeed together in partnership. I want to close with this point. I truly believe we are seeing spectacular innovation in healthcare. Technology is emerging that has the promise to improve the health of Americans. New analytic solutions are delivering insights that could transform our approach to healthcare. While all those things will facilitate change in healthcare, I believe what will ultimately save the system is one thing: our humanity, our ability to focus exclusively on the needs of the customer, to serve that customer, to do what is right for the customer. We do that, and we'll make it to a day where Americans aren't angry about the healthcare system, but they're actually proud of it. Sam Walton laid out a challenge 3 decades ago. I think it is time for us to take up his charge.
Thank you.
Thank you, Lisa and Marcus. Ladies and gentlemen, this concludes today's general session.